A mysterious fever is sweeping across parts of China, leaving thousands sick in just weeks. Health experts warn it could spread beyond borders and you might not even know you're at risk until it's too late. What is this illness? And why is it surging now? Let's break it down. In mid-2025, China, specifically Foshan City in Guangdong province, faced a fierce outbreak of Chikungunya fever. Thousands of cases were reported in just weeks. By July 25, more than 4,000 cases had been confirmed in Foshan, prompting concern from global health authorities. The CDC in the United States began considering a travel advisory as the outbreak escalated. Chikungunya fever is a viral illness transmitted to humans by infected Aedes mosquitoes. After a bite, symptoms usually appear within 2 to 12 days. The most common symptoms are high fever, severe joint pain, muscle pain, headache, nausea, fatigue, and rash. While most people recover fully within a week, joint pain can sometimes persist for months. Severe cases are rare, but can occur, especially in infants, older adults, and people with weakened immune systems. Chikungunya was first identified in Tanzania in 1952. Since then, it has appeared in Asia, Africa, Europe, and the Americas. The World Health Organization warns that over 5 billion people in more than 100 countries are at risk of infection. Recent years have seen the virus re-emerge, with outbreaks in the Indian Ocean islands, parts of Europe, and several countries in Asia. In 2025, significant surges were recorded in La Réunion, Mayotte, Mauritius, and now in China. The outbreak in Foshan began with imported cases in early July in the Shun district. By July 21, cases had risen to over 2,600. Just 4 days later, the total exceeded 4,000, and by July 26, it had reached more than 4,800 cases. Local officials described the outbreak as severe, with hospitals setting up additional isolation beds and public health teams working to contain the spread. China's National Health Commission coordinated nationwide efforts to control the epidemic. Measures included large-scale mosquito eradication campaigns, community cleanups, public education programs, and the deployment of predatory mosquitoes to reduce larvae. Hospitals expanded isolation capacity to more than 7,000 beds. Authorities also imposed fines for failure to follow vector control measures. The most effective way to avoid chikungunya is to prevent mosquito bites. Use insect repellents, wear long sleeves and pants, sleep under mosquito nets, and eliminate stagnant water where mosquitoes breed. 2 vaccines exist: Chikungunya and Chikungunya, but they are not yet widely available. Use in people over 60 has been paused in some countries while safety reviews are conducted. The U.S. Centers for Disease Control and Prevention is evaluating whether to issue a travel notice for China. Travelers should consult their healthcare provider before visiting affected areas. Consider vaccination if eligible, and take extra precautions against mosquito bites. Those returning from outbreak regions should monitor for symptoms and seek medical attention if illness develops. Chikungunya fever is a serious mosquito-borne illness with no specific antiviral treatment. The Foshan outbreak highlights how quickly the disease can spread in favorable conditions. Most people recover within a week, but prevention remains the most powerful protection. Stay informed, take mosquito precautions seriously, and share reliable information to help stop the spread. If you found this information useful, help us spread awareness. Hit the like button, share this video with friends and family, and don't forget to subscribe for more important health updates. Your support helps keep people informed and safe.